Good morning, my name is Utsa Jutva and my topic is AIDS. My content is Introduction, Definition, Transmission of HIV, Pathogenesis of HIV infection, Binding of HIV with cell membrane, Pathogenesis, Symptom and Clinical stages. Introduction. HIV stands for Acquired Immunodeficiency Syndrome. The terms AIDS apply to the most advanced stage of HIV infection. Describe the collection of symptoms and infection associated with acquired deficiency of the immune system. Infection with HIV has been established as the underlying cause of AIDS. The level of HIV in the body T cells count less than 200 and the appearance of certain infectious used as indicator that HIV infection has prolonged to the AIDS. Definition of the HIV. Acquired immunodeficiency syndrome is term that applies to the most advanced stage of HIV infection. Transmission of HIV. There is the main four way to the transmission of HIV: sexual, parental, perinatal or the vertical transmission in the infected body fluids. Pathogenesis of HIV infection. Attachment to the host cell, binding to viral co-receptors, fusion of the cell and the virion by GP41, entry of HIV capsid, conversion of viral ssRNA to dsRNA by RT and its replication, loss of CD4 plus T cells, direct infection and budding, immune activation and apoptosis, toxicity by viral protein and cytokinase, killing by CD4 plus T cells by CD8 plus T cells. Binding of HIV with cell membrane. This is the figure which show a binding of HIV with the cell membrane. Pathogenesis of the how HIV virus is attack or connect with our human cells, or we can say red blood cell, and transmission translation process is occurring. This is the HIV life cycle. Symptom. No symptom develop immediately after the initial infection. Some people have a glandular fever-like illness which can occur at the time of the seroconversion. What are the seroconversion? It refers to the development of antibodies to HIV and usually take place between 6 weeks and 3 months after the infection has occurred. Clinical stages. Symptom. Fever, sore throat, fatigue, weight loss and myalgia. Myalgia means pain in the muscles or the muscle group. 40 to 80% of patients will also exhibit a rash use involving the trunk, diarrhea, nausea, vomiting, night sweat. Aseptic meningitis may be present in a quarter of presenting case. Clinical stage. Asymptomatic. Clinical stage 1. Asymptomatic. Persist generalized perform scale is the asymptomatic or the normal activity. Clinical stage 2. Weight loss. Less than 10% of the body weight is lost. Dermatitis, fungal nail infection, recurrent oral ulceration, herpes zoster, recurrent upper respiratory tract infection. Performance scale. Symptomatic or the normal activity. Clinical stage 3. Weight loss more than 10% of the body weight. Unexplained chronic diarrhea more than 1 month. Unexplained prolonged fever more than 1 month. Pulmonary tuberculosis, severe bacterial infection. Performance scale. Less than 50% of the day during the last month bedridden position. Clinical stage 4 is defined by a Center for Disease Control and the Prevention. Pneumocytosis, toxoplasmosis, chronic diarrhea, more than 1 month, and this scale is bedridden position more than 1 month, or the more than 50% of patient is bedridden condition. Thank you.